Cranial nerve 7 palsy or facial nerve palsy is a disorder of the facial nerve, the peripheral facial nerve, and it can present with weakness of the face on the ipsilateral side, same side as the damaged nerve is, typically presenting with both upper and lower face weakness, and sometimes other symptoms, which we will talk about. So what are the main causes of this? By far, herpes simplex viral infection is known to be the most common cause of facial nerve palsy. But some of the other causes include herpes zoster infection or reactivation of the virus, sarcoidosis, Sjogren's disease, tumors, including tumors that invade the nerve sheath, diabetes, pregnancy, especially towards the end stages of pregnancy, as well as postpartum period. HIV is another cause, and rarely we can see central nervous system pathologies such as a stroke or multiple sclerosis presenting as similar to a peripheral facial nerve palsy pattern, especially when the facial nerve nucleus or the motor neuron proper segment of the nerve are involved. But those are very rare cases. So what is Bell's palsy? About half of or more of these cases, they turned out to be idiopathic in origin. So a workup would not show any cause. And we call those cases Bell's palsy. It's also the idiopathic facial nerve palsy. And it's also important to kind of mention that we think that majority of those cases also happen because of viral infection, namely herpes simplex and herpes zoster activation or reactivation. It's just that we don't have any clinically efficient or non-invasive way to assess for that. So next we will talk about the symptoms of cranial nerve 7 palsy, facial palsy, or Bell's palsy. In order to do that, let's look at the basics of the anatomy first. So looking at the brain and the midbrain, the sagittal cut here. So at the level of the tegmental pons, the lower aspect of it, towards the back of the ventral pons, there's a tiny little bump. The facial nucleus is located almost in front of it. So if we assume this cut is equal to this axial cut right there, you can kind of see these two tiny little bumps, and these are called the facial colliculi. These are important anatomical and radiographical landmarks. The facial colliculi on each side, right in front of them, we're going to have the abducens nucleus or nuclei. There's another one on the other side. And that's in the medial aspects of the ventral tegmental pons, right in front of the fourth ventricle, which you can see it on both cuts. And right next to or lateral to the abducens nucleus, we're going to have the facial nucleus. So what's going to happen here is the motor fibers of the facial nerve will pass first in front of the abducens nucleus, go behind it, and then will exit the pons at the lateral aspect of the pons. And this bump is formed because of this type of anatomy. Remember that the facial nerve also has sensory and parasympathetic fibers associated with it. And those fibers will directly exit and join the motor fibers of the facial nerve. So combination of the sensory and the parasympathetic fibers is called the intermediate neuron, and then combined with the motor fibers, they will go into the prepontine cistern or the pontine cistern, and then next they will go to the internal acoustic canal, and there the facial nerve will meet with cranial nerve 8 in the IAC, and then more distally, each one of those nerves will go to their destinations. So the symptoms associated with facial nerve palsy can include all of these three types of nerve fibers and their prospective targets. Again, ipsilateral facial weakness. It includes both upper and the lower face. So as you see, the patients with this pathology typically present with decrease in the forehead wrinkles. They can present with eyebrow droopiness, as well as the eye droopiness on the same side. And importantly, because of weakness of the orbicularis oculi muscle, if Bell's palsy or facial nerve palsy is severe, it's hard for these patients to entirely close their eyes tightly. So compared to that other side, if you ask your patient to close their eyes, or even if you look at their spontaneous blinking, there's going to be an asymmetry in the blinking. The affected size, the eyelids don't quite close on the top of each other. There's going to be decrease in wrinkles of the lower face, including the nasolabial fold will be decreased, and the lower aspect of the mouth would also be droopy. On your examination, when you ask your patient to smile or show you their teeth, you can notice that on the good side, you can see more teeth compared to the affected side. So that's the motor aspect of the facial weakness. But what other symptoms are associated with this? Remember that we also include parasympathetic fibers and sensory fibers. So patients with Bell's palsy can present with decreasing tear formation. So decreasing tearing and dry eye is a relatively common presentation. And the dryness of the eye can also be because they can't entirely close their eyes, so it remains open at all times, contributing to the weakness and the dryness of the eye. Another symptom that's associated with Bell's palsy is hyperacusis, and that's when patients are too sensitive to noises on the affected ear, and that's because of malfunction of the stapedius muscle, which is innervated by cranial nerve 7. Another symptom is as a consequence of the sensory fibers malfunction, and that's loss of taste in the anterior 2/3 of the tongue because of malfunction of the nerve chorda tympani. So talking about those, and I think it's important to mention another chronic consequence of facial nerve palsy. It's relatively rare. Not all patients present with this, but it's an interesting phenomenon called synkinesis or synkinesia. And what that is as these nerves try to regenerate, there's going to be a miscommunication between the branches of the facial nerve. An example of synkinesia is something called gustatory tearing. It's also called crocodile tear. What that is when patients chew their food, as their salivary glands secrete, their tear glands also start functioning, and they experience spontaneous tearing as they chew. Another example of synkinesia is when the orbicularis oris or the orbicularis oculis activated, the other muscles also activated spontaneously. So as the patient tries to close their eyes, they will experience movements of their mouth, or vice versa. When they're smiling or when they're moving their lips, they will experience movements around their eyes as well. Have any unusual feeling on your face?
Yeah, the right side is active and mobile, and the left side isn't. It's stationary.
Okay, all right. Go ahead and raise your eyebrows. Very good. Close your eyes. Tight, 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 tight. Very good. All right. Open your eyes. All right. That's great. Thank you very much.